Hello, my name is Dr. Julie O'Reilly, and I am a licensed clinical psychologist and a neuropsychologist. One thing that I enjoy about working with the Sticksure Group is being able to really focus my time in the area of concussion, really understanding both those children who have acute concussion or those children who are slow to heal, so they don't follow the typical trajectory of recovery where they may heal within weeks or months post-injury, where their symptoms seem to linger. What's interesting about that is being able to really provide a thorough assessment to try to identify what might be hindering their recovery and providing the proper intervention or resources for the appropriate intervention. With the concussion work, I think a critical piece is also providing the appropriate accommodations and modifications in school. So I try to develop a list based on that child or adolescent's strengths and weaknesses to be able to provide appropriate accommodations in the academic setting. In cases of concussion, what I find is that children who may have symptoms of concussion that linger often end up being much more at risk for things like anxiety or depression. And if the pattern of some of the symptoms continue, again, finding the appropriate intervention for the anxiety or depression is really critical to their recovery. Another area of interest that I have working with the Sticksure Group is assessing children with complex cognitive issues, as well as potentially medical disorders and executive dysfunction that may impact their academic achievement or their social functioning or their adaptive abilities, which is their independence in life. After an athlete sustains a concussion, they may experience symptoms of double vision, possibly nausea, vomiting, headaches. They just don't feel right. They have slowed processing speed. They have problems with attention, new learning, remembering things. And often these things can negatively impact their performance in school or when they return to work. And what a neuropsychological evaluation is able to do is to identify and put numbers behind how significant are these difficulties that a person is experiencing following an injury. And we use this information then to guide the accommodations, different things like needing extended time or possibly needing a different format of a test, different accommodations and modifications. Modifications may include reducing the workload until that person is fully recovered. So we recommend accommodations and modifications in order for that student athlete to achieve their optimal performance and transition back into school following a concussion.